Welcome back. In this morning's Woman's Doctor, time is critical when a person experiences a heart attack, but studies indicate that women wait longer than men to call for help. One possible reason, they may not know they're having a heart attack. And Dr. Reyes joining us this morning with more information. Good morning. Thanks for coming in.
Glad to be here. Thanks.
All right. So heart disease, heart attacks, this is the #1 killer for women?
Yes, actually, approximately 200,000 women die each year from a heart attack. Yeah.
Okay, and so you say women present differently when it comes to the signs. Talk to me a little bit about that.
The signs and symptoms for heart attack for men and women are basically the same, but there are differences, and those differences are important. Up to 40% of women who present for a heart attack don't actually have chest pain, and that can be a little confusing. And it is confusing when people present for a heart attack, it's not always apparent by the EKG.
What are the signs?
So the classic sign is the chest pressure and tightness radiating down the left arm, but that's not always the case here. And when they show up and they have these signs and you get an EKG, only 40% of the EKGs will tell us that there's a heart attack. So we're left with 60% where we have to figure that out.
So if women present differently, don't necessarily have the chest pains, how would a woman know if she's experiencing a heart attack?
That's the problem, and historically we might have approached this in the wrong way. We've always thought that maybe women were protected from heart attacks. They do present later in life, like up to 10 years later than men with cardiovascular disease. So it puts them at a disadvantage for diagnosis, and we actually miss it sometimes.
And so time is critical.
Well, time is muscle, and it's always we like to catch someone with a heart attack within a magic hour so we can help reperfuse. That means open up a blood vessel that's blocked and help that muscle recover. Okay,
so I'm having a heart attack. How do I know as a woman?
Well, the other symptoms are similar. That would be acute onset of shortness of breath. Sometimes there can be nausea, unexplained, or some discomfort radiating to the neck or back.
Okay, so when should we go into a doctor?
Well, if you start experiencing those symptoms, especially with exertion, you should call your doctor or your cardiologist.
Okay, Dr. Reyes, any last piece of advice you want folks to know when it comes to heart attack, men or women?
Is to take any signs or symptoms seriously and to monitor your own risk factors. If you have a family history, if you have high cholesterol, if you have diabetes, and some of those risks are higher for women, especially the diabetes, high triglycerides, if your good cholesterol is low, and uniquely, obesity and a sedentary lifestyle is more risky for women.
And of course, we want to eliminate this altogether. What are some things we can do to lower our chances?
Well, that's interesting. With women, it's exercise and fitness is really important and decreases that risk.
Yeah, it's key. All right. Thank you so much, Dr. Reyes, for coming in.
Thanks for having me.